Saying that, I will introduce the agenda. We will have first Joan from EIT Health Spain. Then we will have a presentation of iRaise by Vicente, and then we have the teams explaining Bambino Jesus first, X Time second from last year edition, and from this year. Okay, we have this. I'm hearing myself with an echo. Okay. Okay. And then we will have this 2021 edition, and this case will be the clinic. We'll do the question and answers time, and then we have the closing remarks by Rosanna. So going to the first speaker of the afternoon, it will be Joan Gracias from EIT Health Spain. Joan is an active member of the health industry. He has more than 15 years experience, including from these 15 years, 5 in the health industry, with a background in business development, management, and engineering. And he was an entrepreneur. He is an entrepreneur and an active member. So now, with no more delay, please, Joan, the floor is yours, and thank you.
Hello, hi, good afternoon, everyone. It is a pleasure to be here today to introduce you what is EIT Health and what we can do for you. So I brought a small presentation. I'm the entrepreneurship lead of EIT Health Spain, and my job is to act as a gateway for individuals, for entrepreneurs, and for startups that wants to join our programs. So first of all, well, our mission, EIT Health, is we want to improve the health and the wellness of European citizens, and we know that the innovation is the key factor to accomplish this goal. Well, EIT Health was created in 2015, and it's a community of the brightest minds in innovation in the healthcare ecosystem in Europe, and we work across borders. And well, we work as what is called the knowledge triangle, that it's putting together to work education, research, and business to work together in accomplishing that innovation. And this was inspired by the MIT methodology. And well, it's EIT Health is part of the EIT, that is the European Institute of Innovation and Technology. And it's the largest ecosystem in Europe, with more than 1,000 partners around the whole continent. And well, the health is one of its communities, and it's called also verticals, and it's also climate, digital, so on. Our presence extends to all Europe, and we are also connected abroad of our borders with other very active innovation ecosystems, such as the States, United States, and Israel. And specifically in Spain, well, our partners are more than 25, and our biggest strength is that as part of our partners, we have healthcare providers, industry, innovation, universities, and also research institutions. So to work together, because we think that that's the way to accomplish and solve that biggest challenges in the health in Europe. And we work across 3 pillars. That it's we have different programs, and we can divide it in 3 different pillars. That is education, acceleration, and innovation. In the first one, education. So we have empowered more than, it's almost 130,000 citizens around Europe with programs such as the session we are having right now. And also we have trained more than 36,000 graduates and professionals. And well, our education proposition, it's composed or offered to both students, entrepreneurs and innovators, professionals and executives, and also to citizens. And to give you some examples, well, we have two pathways. The most important ones are for entrepreneurs, but also for healthcare professionals. And these programs are also meant for citizens, general citizens, to raise the awareness of the innovation and also what is their part of this innovation ecosystem. And just give you some, for instance, in the entrepreneurship pathway, we have on the one hand higher education and students track, so it's degrees and masters programs, and also the summer schools, innovation days, and also some initiatives in higher education. Also fellowships that teaches the needs-led innovation programs, that it means that the innovation comes from the problem, not from the solution, or from the technology, and also the specific tracks of business and entrepreneurship. And in the professionals pathway, we have some upskilling in digital skills, but also in the importance of the high value care, and also in upskilling in innovation to the workforce and the population. To give you some very quick examples, we have here, for instance, the Healthcare Transformation Academy, that it's led by the European University Hospital Alliance, and its objective is to fill the gaps that has the organization and the professionals themselves in innovation and in high value care first. And it's focused on leadership, digitalization, and other related domains. Another one is H-Align, that it's to align different stakeholders that are involved in the ecosystem of innovation in healthcare, and they can work together to implement effectively these innovations. Also, of course, the iRaise, that I guess you will hear much more during this session, but basically it's for upskilling to make more efficient the innovation adoption. And last but not least, the acceleration. We have covered just in Spain 150 startups, in Europe more than 1,000, and since just in 2020, those startups has raised more than 350 million in funding. And our programs are composed depending of what kind of resource you want to achieve on these programs. So the first one is in the knowledge, that in here it's basically there are for early stage projects that wants to accelerate and improve their value proposition, and also later on create a more effective startup and product. On the stakeholder side, it's startups that has a proof of concept, a prototype already, and they want to test it on the healthcare providers, so running pilots with different hospitals and also with different companies. And also some competitions like the Catapult that is happening these days, the semifinals, that is a business model competition. And also the Gold Track, that is for more mature startups. And on the other hand, for those startups that are already on the market, we have the bridgehead that it opened the gates of foreign countries to bring their innovations and to do the first sales on those countries. And of course, the programs that are focused on the investment, on funding those companies. But those programs are changing from year to year, so we are very we're very active in proposing new programs with new value to the different stakeholders. So my recommendation would be just follow us on social media, in LinkedIn and Twitter, so you can be up to date of what is going on at IoT Health, and more important, how we can help you in getting more involved into the innovation in healthcare, and together we make happier and healthier lives in Europe. Thank you very much. Any question, feel free to just reach me by email or social media, or just raise your questions right now. Thank you.
Thank you, Joan. Thank you for the great presentation. Now, we will keep the questions to the end, just in case. And now is the time to Vicente.
Sorry, yeah. Okay, let's move. Thank you. Thank you all. I think that you already, most of you know me. This is Vicente Taber from Polytechnic University of Valencia, and coordinator of iRaise this year. And well, I will go fast because I think that the most interesting are what's going next. No, I have to hear some reflections from the different presentations from Bambino Gesù, Exit Time, and Hospital Clinic, and also the closing remarks by Rosanna Alessandrello. I would like also to have the chance to really appreciate the main organizer of this event, that was Ursio. So Ursio, thank you. Why iRaise? I think that you all know that's because at the end, I mean, we don't want just grants. What we want is that those grants generate impact, and just those public procurements, for example, just help to achieve the goals. No, so that's something that nowadays still we have to improve our success rate. You know, we are complaining about the amount of money that is invested in health, but also we want just to create a real change. So that's we need for that the right people, and that's why we created a iRaise, and in the past was named UpRaise. So that's a hands-on training program for teams of professionals from healthcare organization. Here we are not just talking about medical staff, but about any person that somehow is involved and providing value in those healthcare settings. And what we want is just to promote innovation adoption. So that's why we were just looking for demand-driven. So we were demanding needs from the different alumni that have been attending the course, and looking always for sustainable adoption. It's just not adoption, but adoption that should be sustainable because it's really worthy. Those were the skills for innovation adoption that were selected. I mean, we have in different colors the ones that we have been already working more with the different teams, no? Application of practical thinking, analysis, problem solving. I mean, just to force, and even in some cases you recognize that it was hard, and that sometimes we will say, stop, don't go too fast, but let's start and let's rethink in a different way. Just for those ones who are not so familiar, that was the learning design for this program this year, where we have the course was arranged to teams, to multidisciplinary teams with coming with an unmet need, where most of the teams were among 3-5 members with an institutional support. And okay, we have been using a poly format that was a digital platform combined with in-house real challenges. That's so we have been working, I mean, most of the Fridays, maybe one hour with some concepts, and later we were just moving this into practice with different tools. And with I think that's something that makes also the difference. That's the mentorship meetings. No, every week we were running this, and that's also worth to mention the collaborations and the support from the iRaise Industry Innovation Alliance and the alumni network from IT Health. So that was our learner's journey, the rainbow of colors. So we were moving from what's a need about till how to perform a presentation with a different set of points, and going through a marvelous team of lectures. So I also mentors, but I have not all the pictures, but just to say again, thank you to all of you. This is a real need, and we have some testimonies from past learners from 2020 edition. This year we are still going to collect some real testimonies, but I mean, I'm not going even to read, but it's just to mention or just to look how that helps just to understand from different perspectives to improve outcomes or the real impact that has on the topic. So that's something that thank you. Just to give some words in a nutshell, this year the iRaise journey started the 18th of September with a weekly 2-hour session with an additional weekly mentoring sessions with free breakfasts that were performed by Itemas, Fenin, and General Electric, and also with a 3 hours online site visiting where we were providing additional support. So more than 80 people involved, different videos about the unmet needs. The course took 10 weeks, inside seminars, 9 training sessions, 96 mentoring sessions, and I mean that's a huge effort. So just to make you an idea, just taking into account the effort spent by students and lecturers, and for sure that in students was even more. We are talking about that more than 3,000 hours joint effort just to boost innovation adoption. So that's something that's really worthy, and that's today is the proof now of those teams, 2 from the past, 1 year ago, and 1 from this year, that are going to share with you their experiences. So that's something that's really worthy, and that proves that the iRaise is cost effective. So here I'm just giving some additional information from the iRaise and the Twitter, and also my contact details just if needed. And from now on, Uxio, you are the master of ceremonies. Please give the floor, I understand, to the next person.
Okay, thank you, Vicente. Thank you for the presentation. And now we move to the last edition of the iRaise. It was called iRaise back in the days. Now it's iRaise. The first team that we had is Bambino Gesù from Rome. We have here Kirsten Miller. And if you want to share, or I do share.
I can try, as Vicente knows.
Just in case you have it as well.
Yeah, that we'll give it a try, but for some reason Microsoft Teams is just not does not like me very much. But let's try, shall we? And you'll let me know. Okay, very slowly. Can you see my screen?
Not yet.
Not yet. Okay. We'll try again. It doesn't like Microsoft, Macintosh very much. Okay, I think I'm gonna ask you to share because this doesn't seem to be working as usual.
No worries.
I'm not a Mac girl, so Microsoft I think knows that and is holding it against me. So hi everyone, my name is Kirsten. I know I don't sound like it, but I am coming to you from Italy, Rome. And we were a part of the iRaise cohort of 2020. And if you could go to the next slide. Can I drive or you drive? Okay. So my hospital, Bambino Gesù Children's Hospital, we are an academic and research hospital for children only. We cover all pediatric specialties. We have 2 million clinicals encounter a year, 85,000 ER visits, 30,000 inpatients, and 2,500 staff members. And my ultimate boss is actually the Pope, because we are owned by the Vatican. And so last year we were lucky enough to join the team. Thank you. This is our team. We joined iRaise and we thought we were so far ahead of the game. We had put together a multidisciplinary team. We had the chief of our neurosurgical oncology unit, a nurse from neuro-oncology, a pediatric oncologist, a research fellow and data manager, and me, yours truly, innovation team. And we knew the problem we were trying to solve. We'd already set up a partnership with a technological company. And so we were really cocky coming into the program. And we thought, you know what? We've gotten the first half of this program down. We're really going to have to start, shaking things up when we start getting into business case and things like that. And then we started and we were asked, what is your unmet need? And we said, well, we're dealing with families with hydrocephalus. It's very complicated, but what is your mission? How can you put your mission into one sentence? And it is such a complex problem. So it took us quite a while to come up with this one sentence that sounds kind of simple, but it was so important for us to be able to synthesize what it was we were doing. And so going through the course, we were able to come up with our mission statement, which is hydrocephalus, the #1 treatment, an implanted shunt, fails 50% of the time. Its non-specific symptoms lead to harmful interventions, yet can delay care when necessary. And this made it a lot clearer, and we kind of had to beat ourselves up a bit. And then going into the course, they started asking us harder and harder questions that we kind of knew the answers to. You know, who was involved, who were the beneficiaries, who were the stakeholders, and it was a lot of things to answer. So we found a tool that helped us out quite a bit, which is the integrated patient journey map. And what this does is it answers the who, what, why, where, and when questions. And so we started with one patient. If you can go to the next slide, please. And this is pretty complicated looking, but I'm just going to walk you through it pretty quickly. Next slide, please. But we took one patient, Marco, and this is sort of his history. And we went through his physical journey. Next slide, please. And here you can see where he physically was and what was going on in each of those spaces. Next one, please. And this gave us insights into the clinical effectiveness of his cure pathway. Next slide, please. We then traced his emotional journey to understand what he was feeling at each point. And then we went into safety and governance, which is who he was dealing with and what their roles were in his journey. And this allowed us to understand the aspects of patient safety based on the responsibilities of different actors and their associated regulatory constraints. And towards the end of this, next slide, please. Going through this whole thing, we added two things at the bottom, which were problems and opportunities. And going through the whole patient journey, we found where we had problems, like this situation where, oops, sorry, slow down one second, where the mom sent an email, it was to the general email, but it didn't go to Marco's surgeon or Marco's oncologist. And so we realized here we needed to have a clear-cut communication channel from the family to the surgeon and the oncologist, so that they can start reporting shunt issues directly to the appropriate team. Next slide, please. And so we did this throughout the whole patient journey, and we found out where these opportunities are. And we were able to classify them into different categories, which allowed us to understand what the functionality of our solution needed to have. Next slide, please. So we came up with the most important things were image sharing, symptom tracking, communication, a reporting system, and an alert system. And we were like, okay, great, we know our functionality, but then our teachers made us go and do some more research. What was the state of the art? Next slide, please. So we took each of our functionalities and we said, what else is out there that's already doing what it is we're trying to do? And why is it good, but then why does it not work for our situation? So we looked at so many different things, WhatsApp, Slack, also remote shunt monitoring from the shunt companies themselves. Next slide, please. And this also made us understand who the beneficiaries of this was. And so we had to map out who were the beneficiaries. And we kind of had an idea, but really sitting and having to think through it allowed us to understand who we could also involve in this whole process. Next slide, please. And how we could involve them was by showing them what their value propositions were, and understanding what each sort of group had to gain from us being successful with this project. Next slide. Oops. Yep. Thank you. And how we were able to get their buy-in and support. And this is one of, I think, the most important lessons that we got out of the iRaise course, which is trying to onboard so many different people in different areas as early as possible and get them excited about what we are doing. And I feel that a lot of these projects sort of go into silos. You work with your team, and then at the end, you want to show it off. But by doing that, you are robbing yourself of getting other people to start helping you with it, to get the word out, making introductions. And this is one of the most important things that we learned in this. And we have definitely been implementing this lesson. Next slide, please. Here we had to come up with, what we were trying to achieve. What was this mission going to do? How were we going to impact the patients, the hospitals, and also where that crossover is? Next slide, please. So how are we going to do this? We just thought we had to sort of build something and go ahead with us. But thanks to iRaise, we learned it's maybe a little bit more complicated and requires a bit more planning than just putting together, a bunch of technology. Next slide, please. So the way to start this was we had put together a three-way partnership, which involved our hospital, a patient association, and our technology partner. And this was the first time our hospital had ever had a partnership quite like this. So part of our learning process was also, how do we get this cleared through our ethical committees and all of these, but we managed to do it. Next slide, please. And we came up with a roadmap that we still refer to this day. This took a really long time to come up with, but it is something that even a year on, we still come back and we say, okay, where are we? Have we done this? Have we gotten, that done? And it was really having us think out each step that was so beneficial, because we were ready to sprint, and this is a marathon. And iRaise really showed us that this marathon, you need to do it mile by mile. You can't just kind of run your way through. And next slide, please. We were able to identify key partners outside of our three-way partnership, but who else were we going to be able to involve in this project to see it through, to make it successful and help us diffuse it? And these are things that we had to really take time and think about and go through, and we probably would not have done this without the course. Next slide, please. We had to figure out what the cost and the budget was, which was our least favorite parts is dealing with the money, which I think is a lot of people have that phobia, but we were really helped to figure that out, along with these sort of intangibles, the social costs and the quality of life elements. What were we doing with this? How were we going to be improving our patients' lives, but also alleviating some pressures on the social care system? Next slide, please. And then we were made to, again, ask these hard questions. So what is going to stop this from being successful? Which is something you never want to ask yourself when you're trying to build a new technology or moving forward, but it's something that you need to think about. And so our first risks were, what if another technology emerges that's better than what it is we're creating? And we said, well, who would do that? That would probably be the shunt manufacturers. So you know what? We reached out to the shunt manufacturers who we deal with the most, and they said, yeah, no, we have absolutely no plans to start developing something like that. And then the next is, well, what happens if the solution is not used? Well, that's a risk you take, but what can we do to abate that risk? And big part of that was engaging the stakeholders from the beginning, as I spoke about earlier, and keep them updated and keep them involved in this. And by getting everyone who is going to touch this at some point involved in the early stages, there's a better chance that they're going to adopt and use it. And then the last was costly in terms of human resources, which let us know that we were going to have to automate this instead of just relying on our nurses to collate our data. So last slide, please. This is our lovely team outside of our hospital, which, yes, we get to show off our view a little bit because it is a bit magical looking over Rome. But what we all took out of this process going through the iRaise course is now something our knowledge is being applied to other projects within our hospital. And as I said to Vicente the other week, it's almost like we were contaminated. And we are now spreading that contamination of ideas to wider and broader circles within our institution and sort of bringing them over to the dark side of it to start getting people involved in innovation now that we have a clear idea of what it means, but also not only what it means to create something new, but how to make it successful. And I think that that was one of the greatest things that we got from the program was, you know, in this day and age, a bunch of people can put together some technology and call it a solution, but you can make it, but will people use it? And so the steps that we learned about ensuring the success of our project has been one of the most valuable lessons. And again, we are applying what we learned to other projects going forward. So thank you. And thank you again to everyone at EIT Health and particularly Vicente and Rosanna, who have been great supporters and have seen us along our path.
Thank you, Kristen, for this great presentation. As we are to run the time good, we will keep the questions to the end. But just, or you can write it if you want, the rest of you in the chat, and Kristen will respond it. And now we have John Lodge from HexiTime is our next speaker. John was, as I said, is founder and CEO of is it correct? Yeah, of HexiTime, and member of last edition, and he will explain a bit more of HexiTime. So please, John, the floor is yours.
Hi, yes, thank you. So yeah, we're a UK-based company, and it was myself and my co-founder, a medical doctor called Hisham Abdallah, that came to the iRaise program looking for support because we had developed this innovation but had no real history as businessmen or innovators and understanding real value proposition and how that applies. So much like Kiki, we turned up to the program with what we thought was quite an established idea, and when I look back on it, I found that some of the most important things that we received from the program was that honest and confidential challenge to really scrutinize the thinking that we had behind our business and our product. And I'll share my screen in a moment and show you some of the product. But when I look back on it, I think I valued most some of the honest, tough mentorship that we received. And one of the most important breakthrough light bulb moments for us was when we had it clearly explained the difference between our users and our customers. So we had developed an unmet need and a product based around what our users wanted, but our users don't pay for our product. And so we had this whole side to our business that was painfully exposed during the program. What was nice about the program was it was giving us protected time as the co-founders to stop running the business and to think on the business and about how the business is structured. And the most important output for us at the end was creating this value proposition for the unmet need of our customers, the paying individuals. And of course, the methodology and the discipline of the touch points behind that structured process was really nice, because as co-founders, we were so used to trying to lead other people and have the answers. And it was really nice to have a mentor and a program structure to guide us through a logical process to have these answers. So for a bit of context, I'll just show you what we do at HexiTime. So we create, we're a digital marketplace. And in this digital marketplace, people trade their time as a tokenized currency. And they do so on the basis that an hour is a credit. So here's HexiTime, here's our product. We're global in our reach, and people join the marketplace to share their skills and expertise to improve health and care services. And you'll see on the platform here that we run this item here called a campaign. And this whole section of our business here, this campaign, was part of the solution that we developed with the program to monetize and commercialize our product. And this part here was really heavily influenced by the iRaise program about how we delivered value to people that would pay for it. Because before the program, before we really had this established, we were mainly focused on our users, and this is where our users come in. They either ask for help through what's called a request, or they offer help of their time. So we'd got this user base side quite nicely established, but of course it's almost impossible to monetize this on a commercial level, and this is where iRaise supported us with this side of our program. So in these areas, people can have like a specific call to purpose. So for example, here we've got people in a part of London sharing expertise for increasing uptake of the COVID vaccine, and clearly that's a deliverable on a need for that product. And we also started to think through the program around some of those needs at the customer level. So for example, customers came back to us and said, we really need to understand how our communities and networks are functioning. And that led us to deliver products like this, for example, where individual users are not particularly interested in this kind of product, but a network owner and a paying customer is incredibly interested in this, because it provides a high level of intelligence about where skills gaps are across their community, who their major actors are, and where they can intervene with limited time and resource and have the most impact on their community. So in summary there, my point really was that we took a nice idea, and through the program was able to commercialize it a lot better by listening to the needs of our customer. I'll just stop sharing there, and I'll just reflect more strategically on what we've done since the program. So as a result of being able to commercialize this product, we were then able to start taking this with a clear pitch to other countries, and EIT have been really fantastic in that, and it was the iRaise program that then connected us into other programs. So shortly after iRaise, we took our pitch and our refined understanding of our products to another EIT program called Startups Meet Healthcare Providers. And it was all the work on iRaise that allowed us to get into that program. And we've now been introduced to a customer in Latvia, to a children's hospital in Latvia. And we're at the last stages now. We're hopefully just about to sell our product into that Latvian children's hospital. We should find out before Christmas. But my point is the pitch and the clear articulation of the need and the solution was developed and refined in the iRaise program. Linked to that, it's also given us application to apply through EIT to their investors network. So we now have tickets on the EIT investors network where we can take all our iRaise homework and start pitching that even further afield. We've also been really careful to make sure that we make the most of the alumni on the iRaise program. So yes, the coaching was helpful, but meeting people like Kiki, who you've just heard from, and other people in the program, I think was equally as interesting to see how they're innovating and how they're meeting unmet need. And so we've taken advantage of the EIT Slack channels, for example, and that has given us access to to some really interesting conversations. For example, we're now setting up a collaboration with a university in Portugal as a result of the EIT community network, and we've been able to have credibility through that iRaise program and the products that we've developed. So for us, iRaise gave us an amazing opportunity to focus on the business rather than worry about running the business, to develop our proposition to real paying customers, and then strategically start to network us much better into Europe. And I'm just looking at the time. That's me coming on for 10 minutes. So I'll stop there. Thank you.
Thank you very much, John. Thank you for. We have now seen two teams from last edition, and we've seen two different teams and two different challenges and projects, but interesting. And now we are moving to this session. Sorry, to this edition 2021. For this presentation, we have. I don't know who's gonna do it, Ruben and Isaac. We have both of them.
Me, myself, Isaac.
Okay. So we have Isaac here. Isaac is, if I say it right, informatic engineer. He's a CEO and founder of one company, and also Health Circuit, sorry, and also a researcher in the IDIBABS, that is an institute of research related to hospital clinic in Barcelona. Here we are, and Isaac, the floor is yours.
Yeah, we will do the presentation, the three of us that are connected today. So it will start Ruben, then I will follow, and finally Olivier will close. So please, Ruben.
Thank you. Thanks, Sushi, for the presentations. So I will go ahead directly to the presentation. So if you want, Isaac, you can go to the next slide. Perfect. So today I'm going to present what is Health Circuit. So Health Circuit is an initiative proposed by INCASIM, which is a multidisciplinary research team which is born within the hospital, clinic, and IDIBABS environment in Barcelona. The Health Circuit has the strong commitment to make its contribution towards solving one of the major healthcare problems, which is present in a greater or lesser degree in all the healthcare systems around the world. So it's well known that fragmentation of care causes inefficiencies, isn't it? So inefficiencies in healthcare delivery, in care coordination among professionals, and also hinders the proper management of the disease when it requires a close follow-up for the physicians. The next slide, please. So these inefficiencies in the healthcare systems affects them at every level in different ways and affecting different stakeholders and resulting in an increase of the total healthcare expenditure. Next. A suboptimal performance of the healthcare professionals. Next. And a lower user satisfaction, a poor perception of care, and eventually mismanagement of the disease, resulting in a worse prognosis and a reduced quality of life. Next. In this regard, patients with multiple chronic conditions are particularly endangered by going through these complicated transitions across the healthcare system, resulting in recurrent hospitalizations and frequent ambulatory healthcare requirements. To illustrate the magnitude of the problem, I will show you a couple of indicators from Catalonia, where the 20% of the citizens with the highest morbidity burden are the responsible of almost all the unplanned hospitalizations, and in consequence, more than the half of the total healthcare expenditure. Despite the ongoing digitalization of the healthcare worldwide, the deployment of the digital solutions that provide support to truly integrated and personalized care delivery strategies for these patients is still an unmet need. In relation to this, we believe that it's in our hands to bridge the gap between the need and the solution, and this is the purpose of Health Circuit. In the next slide, we will show you a short video about the basis of our solution.
Barcelona-based hospital clinic and IDBIPS are proud to introduce Health Circuit, a smart digital platform that delivers an integrated care management system based on collaborative work that facilitates a connected experience for both the patient and the healthcare professionals. It gives them the chance to start by having real-time chats with their patients and colleagues and quickly move into more advanced features like creating customized content such as questionnaires, creating and managing your own workflow and processes, checking and managing calendars of appointments and tasks, and prescribe non-pharmacological interventions to patients, among others. Health Circuit is also a great tool for patient empowerment and self-management. Patients can participate in effective health coaching and self-management strategies. They can use it on any device to agree on a goal-oriented and personalized health plan to manage both expected and unexpected events.
So Health Circuit is already helping to improve patient care by means of improving health outcomes, efficiently using healthcare resources, and maximizing both patient and professional satisfaction. And is doing this through digital innovation, thanks to its adaptive case management workflow engine that is embedded with a GDPR-compliant multimedia communication channel, and it's powered by artificial intelligence to personalize treatment plans based on best practices for patient-centered care. The cost-effectiveness of Health Circuit approach has been already demonstrated for rehabilitation of patients before major surgical procedures, which is helping to significantly reduce complications, use of healthcare resources, and costs, while fostering post-discharge functional recovery. We are very glad that OECD considers this use case of Health Circuit a good practice, which motivated us, in fact, to apply Health Circuit to other use cases, such as prevention of hospitalizations in high-risk patients, for which we aim to reduce more than 40% unplanned hospitalizations and more than 60% emergency room visits. Therefore, patients and carers will benefit by avoiding unplanned hospitalizations while increasing patient empowerment for self-management. Healthcare professionals will be able to enhance communication and collaboration among them and with patients also, with an ultimate impact on efficiency, and decision makers will be glad to minimize the use of healthcare resources. To this end, our next steps during 2022 will consist on adapting the Health Circuit technology, currently validated with pre-hub use case, to the prevention of hospitalizations in high-risk patients. We will be creating our initial technical and commercial team. We will be pursuing trademark and software copyright registration with the ultimate aim to have a CE mark that will then put us in a good position to start marketing and commercialization actions. To make this possible, our fundraising strategy capitalizes on previous investments on R&D and considers initial private investment and already granted direct public funding from a startup capital program from the government of Catalonia to then be in a good position to attract investors, to consolidate our team and technology, and then for commercial scale-up. Our current business plan forecasts potential benefits already within 2022. So please, Euridice.
Hello, this is our comparative table competitors, and as you can see, all of our competitors provide different types of communication channels. But we would like to stress that both risk assessment processes and adaptive case management are only available using our Health Circuit solution. Next, please. These would be our ecosystem key partners and the main important. And we would like to stress that we have both international partners as Mannheim Heidelberg in Germany and the OECD that we are currently collaborating with in different research studies. On the other hand, also there are national partners who are supporting Health Circuit spin-off launching as CATI and Eurecat. And finally, we are also participating in 2 different projects. One is Jade Care, which is a European Chafia core project, which aims to reinforce the capacity of health authorities to address the health system transformation. And the last one is ShartTech, which is a network which aims to promote innovation and tech transfer to the industry that are also supporting Health Circuit. Please, next. Okay, this is our team. This is us. This is INCASIM. We are a multidisciplinary platform of professionals that advance in the development and implementation of new models of integrated care services supported by digital tools. It is composed by different kind of professionals as physicians, nurses, data scientists, and project managers, and other external collaborators who work together with us. And next, please. Yeah, finally, we would like to stress also the key points that we have learned in this last course, iRaise, and we are very happy and to have been participating in. So first of all, thank you very much for this very interesting training, and just to stress that the key main points that we have improved very well in the focusing the problem statement, also to learn different business concepts, the identification of the main needs of our use case, and for us, also very important thing, to learn explaining better our proposed solution. So next, please. On behalf of all the team, thank you very much. And that's all.
Okay, thank you very much, the 3 of you, for the presentation and to be volunteers for this event. I saw, Rosanna told me that there was a question before, and now we open the question and answer. So please raise your hand, and we will give the floor to someone. Come on, don't be shy. Now is your time to ask, or even yourselves among yourselves.
Yeah, before was Maria Jose Pelaez. I don't know if you want to make the question, Maria Jose.
Sorry, it was a mistake.
Oh, come on.
Sorry.
Just take the time. Just take the chance to make the question.
Sorry.
Okay, I take advantage to jump in because I think that we should congratulate the 3 teams, no? Because they really had a very challenging, journey to do. Because from one side they want to fix the world, and from the other they were willing to learn how to do it. So at least I don't know if they're fixing the world, but maybe they're getting closer to go to the moon. So this is good. And this moon is not so far, and because they are now, and this is wonderful. No, they have now a plan. Some of them, like Exit Time or Bambino Gesù, are already implementing the plan, and also this last team have already a plan. No, so this is very good, and they are already engaging. They want to already give results by the end of this year, 2022. So it's the next year, the next 12 months. So this is wonderful. I have I don't know if any. I see now the deletion appearing. I don't know if you have a question, because I have a question eventually if I. Okay, I'm going to make a question.
Hola,
yes.
Rosanna. Hi.
Hello.
Were you saying myself that I opened the camera?
Yes.
Okay. Yeah, I actually wondered. Thank you for the group's presentations, and the one that I'm least familiar with was the last presentation. So I think I've probably posed these questions already to Kirsten. I'm sure I did. But for the group that just presented, I'm always curious about what your experience has been. Kind of after the course, when you're sharing your learning within your work environment and with your other colleagues that didn't attend the course. How has it been trying to transfer what you're doing? What has been the response as you try to now, implement and innovate once you're kind of out and you're surrounded by your peers and so on, and you're learning in the course, and then you go back and you're trying to move ahead within your organization? I'm wondering how it was received, what your experience has been. Yeah,
if I may, It's been now only 1 week, so and due to the pandemic, we are still not meeting that often as before. But our main aim in joining the program was, in fact, that there is a core part of the team that gets exposed to these concepts and is challenged and how to shape our ideas into potential business concepts. So from this side was, I think, very useful for us, and in our team we were let's say more technical people, more clinical people, and I think this multidisciplinarity was useful. Hopefully during the next days or so we will have further, let's say, internal meetings with the broader part of the group, and then I will be able to provide a specific feedback.
I can come in from Hexi time on that question there. I think for us it may be slightly different in that we set our innovation up as an established company, as a trading company. So for us that team, even though it was me and my co-founder on the program, when we went back to our team, they were the team in our company. So we had a really engaged, easy audience to share that learning and to start developing outcomes as a result of the knowledge that we'd taken from the program. And I think that was, for us, that makes it a lot easier than I think perhaps Kiki, who is having to go back to a complex hospital and try to relay that amongst public sector workers that are busy in their day jobs. Although what I can relate to is the way that we developed our sales pitch really clearly, so that when we did talk to strangers in hospitals, in organizations, they could very quickly understand what we were offering and what our value was.
Great, thank you both.
Thank you to both. I don't know if Kirsten, do you want to add anything or?
I mean, I touched on it earlier, but the questions that Lilith is asking are some of the most important things that came out of our experience, because the onboarding, as John says, in a complex hospital, it's almost like you're speaking another language. And the use of sort of bringing people in and, you know, sort of letting them in on the secret, you know, is an effective way to, you know, bring them to your side and to begin that contamination, because it's not easy. And when Vicente and I were working with our team for iRaise just the other week, I said, you know, changing the way people think is one of the most difficult things to do. Humans do not like to change the way they think. They may think they're open-minded, but when you are really taking those gears and making them sort of go against itself, it's hard. It's very hard. And so it's something that can't be done in a bum rush of that, hey, here's our idea. It's something that you have to approach with that slow and sort of methodological way to sort of, again, bring them over to the dark side. And that is, again, something that was so important. And also, as John said, finding those phrases to just crystallize and put into a nutshell is not something that we're used to doing. And it's, you know, now I am able to talk about this project, throw out that sentence about hydrocephalus, and people are like, oh, okay, so that's what you're doing. Whereas it used to be, well, it's really complicated, and you know, and da-da-da-da-da-da, and now it's like, okay, this is what we're doing. People go, got it. So, yeah.
Thank you, Kirsten.
Thank you. Any further question? Because if not, I have also a question from my side. I heard the three of you saying in different steps, no, of the journey that we did it in upraise, in iRaise, how important are, no, the identification of the stakeholders, but from different perspective, no. For instance, from Bambino Gesù, it was very relevant to understand the complexity of the issue, not to understand then at the end of the day who was affecting when and by what. But then also in a Hexi time, you said clearly that listening the needs of the customer. So not only when we are affecting them, when and how, but also that they have a space now to be listened. And then clinic saying also how to communicate, our learning, how to communicate our value proposition. So also how to, not only that we identify when they are affected, we identify what are their needs, but also how we can communicate to them. I think that this is very relevant, and maybe you want to comment, the three of you, because this is, well, I somehow, this element is in common in your presentation, but with different perspective. Maybe do you want to comment?
I'll jump in. For us,
Yes.
it was really interesting because we ironically we started as we were a business when we joined the program, but we hadn't articulated a need for a customer. We'd been so focused as, I say business, we're what's called a social enterprise. So we were so focused on the needs of people that would benefit from there. And I think that was because me and my co-founder are public sector workers. So we were never too interested on the business side. We were more on the impact on society. And so it was ironic for us that we turned up as an established business without really a functioning business model that was clearly really probably life-saving for the business, being on that program to make sure we refined and articulated that business model. So yeah, my reflection is just the irony of the situation, being the business without the business model, but we finished with one.
Thank you. By the way, that's good. So this journey somehow, with this journey you saw the light, at the end of the tunnel somehow, about what was the road to take. Very good. Thank you. I don't know if Isaac or Kristen, do you want to comment on this?
If I may, I will be quite short. I mean, I think that most of probably the main, let's say, reasoning behind this sentence about that we needed to communicate our added value was mostly due to our interaction with the mentors. That initially they were not really seeing what is the added value out of it. And since they are closer to the market view of this whole story, so I think we are glad that finally we get to get understood by the mentors and hopefully also by potential investors in the future. So that's very key. Yeah.
Very good, very good. So it was somehow testing your message across these mentors classes. Very interesting. Thank you. Kirsten, any final comment regarding this?
Sorry. Hi. So where we are going is now so much clearer, and it helped us to really map out, the way to go and what we're doing. Sorry. And we are now getting ready to start beta testing with our families this week, which I'm sort of very excited to be able to share with everyone, because that's a really huge step. This thing that was an idea, our families are going, who we're really doing this for, who we've been involved with design thinking sessions and other things. And so next week is going to be very exciting, and I'm glad that I get to share this all with you here today, because it's a big step in our process. So thank you.
Congratulations. Thank you very much. Okay, so now Ushio.
Yes.
He is close to me. Because of this, I'm just turning my head.
Now we can do, I mean, if you finish all your comments and questions, then we can go here to this book lab. We have here the QR code, and or you can go here, booklab.com/iRaise CEE, Citizen Engage Event. Please join. It's just 3 questions, just to take your feedback and your knowledge of this session, and we can call it. The number of people is rising. We have 6 now. Sorry, Vicente, could you paste this on the chat, because I am trying and I cannot see where is, so everyone can join. Thank you.
Yeah, I will do it. I was hearing Maria.
Okay. Okay, that happens.
Yeah, that's
Okay.
already in the chat.
Okay, that's already in the chat. We are 17 online, so we can start. And here is the first question. All are open answers. And now that you know more about the iRaise and the progress of its alumni are doing, could you suggest what key elements are necessary to a successful innovation adoption? Take your time. Okay, now we can see here something that we already heard: value proposition, deep understanding of stakeholders, stakeholder mapping, stakeholder identification. That the innovation, of course, really covers the unmet needs. Okay. Well, more or less, I think we all have a common agreement. Business plan, communicate well, user experience.
Great team. That's a good one. I don't know if the team is great or it's
Great team with different skills. Well, it's important to have a.
Exactly.
Now you can see it better. Okay.
I like good mentors. That's key. Okay.
Okay, so we can go to next. And regarding the iRaise, and what contents as skills worked out during the iRaise you consider most relevant to you and your organization? As many of you are iRaisers, you can respond free, no worries. Okay. The worksheet. Okay, I see that someone was fighting against public procurement, economic evaluation, value proposition, FICO selection.
The worksheet is like a nightmare, I believe. But at the end, you could do it.
Indicators, PCP and PPI, programs of innovation, addressing unmet needs, health evaluation. Well, it's cool. Coachable. Okay. Okay, thank you. And last, do you know more or less now something of iRaise? So what additional contents and skills you consider relevant to you and your organization? And if you like to suggest to iRaise to work out. Interesting. Intellectual property rights. Collaborations, okay.
This is not good.
Maybe you must explain, Lisa, the Rafaela Carrà song.
Innovation, investment, incorporate rounds of investment. Very good.
Well, we can see now here that investment, collaborations, industry is a main. Good communication skill.
Okay, I think that.
Okay, so thank you all for this questionnaire, and thank you all for being here, of course, this Friday afternoon. This is the last session of this 2021 edition. So we will close this with you, and we will very thankful for all your support, your patience, and especially your enthusiasm during this course. Hope it you get at least half of the enthusiasm that we feel for you. I don't know if the directors, in this case, the coordinator Vicente, will close this ceremony.
Oh, okay. Just very brief. Again, thank you, Rosanna, Lucio, for also pushing this event and also managing part of it. And to all of you, as I said also last week during the graduation ceremony, where we had also selling carrera, this is not the end. Hopefully, it's the beginning. Let's create community, the iRaise community and the IT Health alumni community. So that's something that also you can see from John Lodge, the value that they got through the IT Health ecosystem. So that's really good. And that, okay, you would still receive some emails from our site about this just some service for the future, and also just to download your individual certificate from the course. No, in addition to this, to the one for the team that we would also send to you, we would just provide an individual certificate. And again, thank you, Lisa, Joanne, and also Claudia were there. Thank you for being and supporting this almost last event, because okay, we are always ready to arrange something in very fast. If we are still open to not only to IT Health but all of you. So if you need any kind of support, clinic, DBAPS, PSET, Biodonostia, that I saw Maider, people from Sermas. We are just ready to serve. No, so thank you all, and enjoy this long weekend, at least for the Spaniards, but also for the rest. I think you deserve a lot of weekend. I don't know if you will got it, but at least you deserve. Okay, bye. Enjoy.
Thank you.
Thank you very much. Bye.
Bye.
Thank you.
Thank you.
Bye.
Bye.
Goodbye.
Bye.
Bye, everybody.